As we age, it's easy to dismiss certain changes in the body as simply getting older, but there are signs that should never be brushed off, subtle indicators that something deeper is going on inside your body, possibly pointing to serious health concerns that require immediate attention. Many seniors start to feel more tired than usual, or they may find that everyday tasks seem to take more energy than before, but persistent fatigue that doesn't go away with rest is one of the most overlooked early signs that the body is in distress. This isn't just about being sleepy. This kind of exhaustion can be a warning that the cardiovascular system is struggling to deliver oxygen-rich blood, that the thyroid is slowing down, or that the immune system is working overtime due to inflammation or infection. What's dangerous is how easy it is to normalize this constant tiredness as just part of aging, when in fact, it could be a signal that your organs are not functioning at their best. The heart, in particular, relies heavily on subtle energy cues to indicate when it's under pressure. Shortness of breath during mild exertion, frequent lightheadedness, or a general feeling of weakness can all indicate that the heart isn't pumping efficiently. This could mean early heart failure or arrhythmia, conditions that can be managed if caught early, but become dangerous if ignored. Another sign many seniors overlook is unintentional weight loss or gain. Suddenly dropping pounds without changing your diet or gaining weight, especially around the abdomen, can suggest hormonal imbalances, metabolic dysfunction, or even cancers that are affecting the body's ability to absorb nutrients or regulate fat storage. These changes can be gradual, so they're often missed until the body has already gone through significant internal shifts. Watching your weight isn't just about appearance. It's about understanding what your body is trying to communicate through subtle shifts in mass and composition. Alongside that, changes in skin texture or tone, like unusually dry or discolored patches or skin that bruises easily, may not just be a cosmetic issue. Skin is the body's largest organ and often reflects what's happening inside. A yellowish tone could indicate liver problems, while persistent itchiness or flakiness could suggest kidney dysfunction or diabetes. It's critical to pay attention to what's showing up on your skin, as it may be the first visible sign of organs under stress or nutrient deficiencies that are impairing proper regeneration. Another commonly ignored issue is frequent forgetfulness or mental fog. While a little absent-mindedness can be expected, consistent difficulty recalling words, names, or directions may be an early symptom of cognitive decline or the beginning stages of dementia. The brain, like any organ, needs adequate oxygen, nutrients, and stimulation of function, and when circulation or chemical balance is off, the first sign is often mental. Sleep disturbances, too, are a major red flag. If you find yourself waking up frequently at night, or sleeping all day but still feeling tired, it may be a clue that something's interfering with your body's natural repair processes. Chronic sleep disruption can indicate neurological issues, respiratory problems like sleep apnea, or even undiagnosed anxiety or depression that's disrupting your circadian rhythm. The consequences of poor sleep compound over time, weakening the immune system, accelerating cellular aging, and impairing memory and focus. Moreover, one sign that many seniors think is just aging, but can actually mean serious internal decline, is swelling in the legs, ankles, or feet. This is called edema, and it may suggest that the heart, liver, or kidneys are having trouble processing fluids. Left unaddressed, this can lead to tissue damage, increased blood pressure, and even heart failure. Sometimes this swelling is accompanied by a feeling of heaviness in the legs or reduced mobility, which in turn leads to further inactivity and worsened circulation. That creates a feedback loop where inactivity worsens health, and declining health discourages activity. Another subtle but critical sign is a change in your bowel or urinary habits. Constipation, diarrhea, difficulty urinating, or sudden urgency can signal everything from digestive tract issues to neurological disorders or even cancer. When your body systems are struggling, they often reveal themselves through elimination patterns because that's where so many organs work together. The liver, kidneys, intestines, and bladder are constantly managing waste, and changes in this balance indicate something deeper may be occurring. These signs are often ignored out of embarrassment or the assumption that it's just an age-related nuisance. But they're worth taking seriously because catching them early can prevent serious complications down the line. Appetite changes are another red flag. Losing interest in food or finding it harder to enjoy meals could be more than just psychological. It might indicate gastrointestinal problems, hormonal shifts, or even early signs of depression, which is highly underdiagnosed in older adults. If your body stops asking for nourishment, it may be signaling that systems are slowing down or shutting down. And along those lines, thirst or lack of it is also important. Many seniors don't feel thirsty even when they're dehydrated, and chronic dehydration can strain the kidneys, worsen cognitive function, and affect electrolyte balance. Your body's ability to regulate hydration weakens with age, but that doesn't mean the need disappears. Staying hydrated is essential for joint health, brain performance, digestion, and cardiovascular function. And noticing a sudden drop in thirst could be a sign that internal sensors are no longer working efficiently. Pain that seems minor but lingers is another alarm bell. Whether it's a dull ache in your back, recurring headaches, or stiffness in your joints, this pain often has a deeper root. Sometimes it's musculoskeletal, but often it relates to nerve damage, inflammation, or even vascular issues. Many people take painkillers and move on, but that can mask serious problems like peripheral neuropathy, spinal issues, or chronic inflammation that accelerates aging from the inside out. Listening to your pain, especially when it's persistent and unexplained, is a crucial part of staying on top of your health as you age. As these symptoms begin to accumulate, it becomes even more vital to recognize that the body is not just giving random signals. It's communicating through physical changes that something is deteriorating within, and many of these signs, if properly acknowledged and investigated, can be reversed or managed to prevent serious decline. One of the most underappreciated but impactful signs is a general loss of balance or increased clumsiness. When someone who was once steady on their feet starts stumbling over nothing or feels uncertain on stairs or uneven ground, it may point to neurological deterioration, inner ear dysfunction, or even weakening muscles that are no longer providing the structural support the body needs. Balance is not just a matter of strength. It involves complex coordination between the brain, nerves, muscles, and joints. And when any one of those systems starts to falter, the body loses its equilibrium. This seemingly small change could actually be the early manifestation of Parkinson's disease, multiple sclerosis, or the early stages of peripheral neuropathy. Seniors who report feeling dizzy when standing up too quickly, or who are experiencing vertigo episodes, may also be showing signs that their blood pressure regulation or heart rhythm is no longer consistent, something that, if left untreated, could increase the risk of falls, fractures, or strokes. Falls are one of the leading causes of hospitalization and death in older adults. Yet the early warnings that lead to falls, like instability or lightheadedness, are too often ignored until the damage is already done. In the same vein, another sign that shouldn't be dismissed is persistent shortness of breath even during minor physical activities. Walking across a room, climbing a few stairs, or even speaking in full sentences shouldn't leave someone gasping for air, and if they do, this could be a strong indicator that lung capacity has diminished, the heart isn't pumping efficiently, or that there's an underlying inflammatory condition affecting the airways. Chronic obstructive pulmonary disease, COPD, congestive heart failure, and anemia all present with shortness of breath, but so can less obvious issues like sleep apnea or silent aspiration during meals. These kinds of conditions often build quietly in the background and then reach a tipping point where what was once a minor inconvenience turns into a life-threatening situation. Unfortunately, the body adjusts subtly, So many older adults simply reduce their activity instead of addressing the symptom. They stop gardening, they stop walking to the store, they avoid stairs, and eventually the body becomes deconditioned, which accelerates aging even more. Muscle mass decreases, circulation worsens, and the immune system becomes sluggish. What's more, people begin to feel mentally sluggish alongside the physical fatigue, which leads us into another often dismissed signal: cognitive slowing that isn't yet dementia but should not be considered normal aging. This includes taking longer to process information, struggling to follow conversations, or feeling mentally foggy for no clear reason. It can be caused by poor circulation to the brain, early neurodegenerative changes, or imbalances in critical neurotransmitters. Mental sharpness is one of the first faculties to fade when the body is under chronic stress or nutritional deficiency, especially when there is insufficient intake of essential vitamins like B12, folate, or omega-3 fatty acids. Poor nutrition is often a hidden contributor to these signs of aging. Many seniors don't eat enough protein, healthy fats, or nutrient-dense vegetables due to reduced appetite, dental issues, or the convenience of processed foods. Over time, these deficits lead to anemia, muscle wasting, and compromised organ function. In particular, the liver and kidneys rely heavily on consistent nutrition to filter toxins and maintain balance in the body's internal chemistry. And when they're stressed or malfunctioning, the symptoms can appear slowly: low energy, difficulty concentrating, dry skin, fluid retention, and changes in urine color or frequency. Many seniors ignore these symptoms, chalking them up to aging, but they're signals of deeper metabolic imbalances that can be corrected if caught early. Another sign that shouldn't be ignored is a change in mood or emotional stability. Seniors who were once calm and balanced may suddenly become irritable, anxious, or withdrawn. While some may attribute this to loneliness or boredom, it's often a physiological issue involving neurotransmitter decline, hormone imbalance, or chronic inflammation that affects the brain. Depression in older adults often looks different than in younger people. It might not be sadness, but rather apathy, unexplained fatigue, or even increased pain complaints. This emotional dulling is dangerous because it leads to isolation, reduced self-care, and delayed medical attention. The body and mind are intricately linked, and any emotional shifts must be viewed as potentially stemming from physical dysfunction. The same can be said for sudden changes in hearing or vision. Many older adults experience gradual changes in these senses, but rapid or dramatic shifts, like seeing floaters, hearing ringing, or noticing that things look dimmer or fuzzier than they used to, can point to serious underlying issues such as retinal detachment, macular degeneration, or even mini strokes. Hearing loss, in particular, is strongly linked to cognitive decline because the brain begins to lose stimulation from sounds, leading to decreased function over time. Seniors who begin withdrawing from conversations or avoiding social interaction due to hearing difficulty often experience a faster decline in memory and decision-making ability, which is why hearing issues should never be ignored. Your body relies on all your senses to stay connected to your environment. And when those senses are dulled, your internal health often follows the same downward path. Perhaps most critically, an overall decrease in resilience, the ability to bounce back from illness, injury, or stress, is one of the clear signs that the aging process has accelerated beyond normal. If it takes longer to recover from a cold, if a bruise lasts for weeks instead of days, or if emotional upsets linger longer than before, these are signs that the body's repair mechanisms are slowing down. This could reflect declining stem cell activity, reduced hormone levels, or impaired cellular repair due to oxidative stress and inflammation. These are complex processes, but the body shows them in very basic ways: fatigue, slow wound healing, low libido, poor digestion, and loss of motivation. When these signs all begin to appear in combination, they paint a much bigger picture than any single symptom. Aging is not just about what you feel, It's about what you're no longer able to do without difficulty, and those limitations can be tracked to very specific physiological declines that should never be accepted as just part of getting old. By understanding these signals as warnings rather than inevitabilities, seniors can take proactive steps to restore their vitality, and that begins with awareness of what should never be ignored. What becomes even more critical at this stage is understanding that the most dangerous signs are often the most easily dismissed, particularly when they involve internal sensations or gradual declines that don't seem urgent, but are actually red flags that something in the system is faltering. One of these is unexplained weight loss or sudden changes in appetite. For seniors, this isn't simply a matter of eating less. It's a possible indication of gastrointestinal disorders, metabolic dysregulation, or the onset of diseases such as cancer, thyroid imbalance, or diabetes. Many older adults begin to skip meals, feel full faster, or lose interest in food, but this isn't always a normal part of aging. When the body begins to break down muscle for energy, leading to a condition known as sarcopenia, what may appear on the surface as a smaller appetite can actually be the body signaling it is no longer absorbing nutrients properly, or that chronic inflammation is at play. And once this cycle begins, eating less, absorbing less, losing weight and strength, it leads to a downward spiral where weakness becomes normalized. Seniors might attribute it to getting older, but the truth is that muscle loss is one of the most devastating accelerators of aging and is directly tied to mobility, independence, and longevity. Muscle is more than just strength. It's metabolic tissue that regulates blood sugar, supports the immune system, and helps the body handle physical stress. When it starts wasting away, seniors become more prone to fatigue, bone fractures, infections, and even mental decline because the brain is deeply affected by changes in the body's structural and metabolic foundation. Another subtle but dangerous sign is persistent bloating, constipation, or irregular bowel habits. These may seem like minor inconveniences, yet they are often the body's loudest cry for help when it comes to liver dysfunction, digestive tract inflammation, or even early signs of colorectal cancer. The gut is sometimes referred to as the second brain for a reason. It governs not only digestion, but mood, immune responses, and even memory through the gut-brain axis. When digestion slows, toxins build up in the bloodstream, nutritional absorption suffers, and systemic inflammation increases, leading to fatigue, cognitive fog, and suppressed healing. Seniors experiencing these issues often try to treat the symptoms with over-the-counter remedies without realizing that the cause might be something far more serious and progressive. Equally overlooked is the loss of skin elasticity and sudden changes in skin tone or texture. While many expect wrinkles with age, the skin can also provide critical insights into internal organ stress. For example, yellowing skin or eyes can indicate liver dysfunction. Dry, flaky skin may point to thyroid problems or poor circulation. Sudden bruising might signal blood disorders or vitamin deficiencies. The skin is a mirror of internal wellness, and when it begins to thin, tear easily, or develop unexplained rashes or spots, it often corresponds with decreased collagen production, impaired blood flow, or nutrient malabsorption. All things that can be managed if detected early. Ignoring these signs can lead to delayed diagnosis of diseases like diabetes, kidney disease, or autoimmune conditions. What's equally insidious is the slow degradation of sleep quality. Seniors often report sleeping less or waking frequently during the night, but poor sleep isn't harmless. It has been strongly linked to cognitive decline, heart disease, immune suppression, and metabolic syndrome. Sleep is when the brain clears waste products, the heart slows down to rest, and the immune system repairs cellular damage. So when sleep becomes fragmented or light, the brain doesn't get the restorative cycles it needs, leading to increased inflammation, memory lapses, irritability, and even depression. Some seniors may wake up feeling tired despite a full night in bed because the depth of sleep was never sufficient. Sleep apnea, restless leg syndrome, and nighttime acid reflux are all treatable issues that rob older adults of restful sleep, and yet they are frequently dismissed as normal parts of aging. They are not. Just as critical is vision loss, not just in acuity, but in adaptation and perception. Seniors who begin struggling with glare at night, have trouble distinguishing contrasts, or notice slow adaptation between light and dark environments may be experiencing early signs of cataracts, macular degeneration, or optic nerve deterioration. These changes not only affect safety, especially when driving or navigating stairs, but also signal deeper vascular or neurological issues that can extend far beyond the eyes. Reduced blood flow to the eyes can be a marker for increased risk of stroke or cardiovascular disease, and the nerves that control eye movement and processing are some of the first to falter in degenerative conditions like Alzheimer's or Parkinson's. That's why regular eye exams are not just for updating glasses. They are critical for monitoring systemic health. Another key sign that should never be brushed off is chronic fatigue that doesn't go away with rest. This is not just being tired. It's an overwhelming sense of exhaustion that affects concentration, motivation, and physical ability. Chronic fatigue can signal anemia, chronic infections, undiagnosed autoimmune conditions, or hormonal imbalances such as adrenal fatigue. In some cases, it can also be the first sign of cancer. The problem is that most seniors don't report fatigue to their doctor unless it's extreme, and even then, it's often dismissed or chalked up to old age. But energy is a core currency of health, and when it begins to disappear, there's almost always a deeper physiological cause. Finally, seniors who begin to isolate themselves, withdraw from activities they once enjoyed, or avoid phone calls and social interaction may be showing signs of depression, cognitive decline, or hearing loss. Isolation isn't just a result of aging. It accelerates it. Studies have shown that loneliness is as dangerous to health as smoking 15 cigarettes a day, yet remains one of the most overlooked risk factors in aging adults. Human connection is essential for mental stimulation, emotional health, and even physical immune resilience. When a senior stops engaging socially, it may be because they're embarrassed by memory issues, frustrated with physical limitations, or simply too tired to pretend they're okay. Families and caregivers must view withdrawal not as a personality change, but as a symptom of deeper distress. Together, these aging signs form a constellation of critical indicators that the body is no longer functioning optimally. None of them should be accepted passively. By treating these not as inevitable, but as invitations to investigate further, seniors and their families can drastically change the trajectory of aging. Many of these signs can be reversed or improved with proper nutrition, physical activity, medical care, and emotional support. But it starts by taking them seriously and refusing to dismiss them as just part of getting older. Every ache, every change in sensation, every new limitation carries information. And when that information is acknowledged, it opens the door to better health and longer life. When we piece together all these signs, from subtle shifts in weight and sleep to cognitive, emotional, and physical changes that seem to sneak in unnoticed, what we are truly observing is the body's way of communicating distress long before it reaches a critical stage. And yet, so many seniors dismiss these signals as mere inconveniences of aging, often because they've been told that decline is inevitable or they've grown used to adapting around discomfort rather than addressing its root cause. But that mindset is one of the greatest dangers to healthy aging. The truth is that the body doesn't suddenly give out. It whispers before it screams, and those whispers come in the form of little symptoms, small hesitations, changes in energy or mood, the need to lean on furniture when walking, forgetting where the keys are again, or brushing off a persistent cough. These are not minor quirks of growing older. They are messages, and the longer they go unacknowledged, the harder they are to correct. What's equally important to understand is that modern medicine and wellness practices now offer a wealth of tools to not only manage aging, but to thrive in it. Seniors today have access to diagnostic tests, advanced nutritional knowledge, physical therapy, cognitive training, and emotional support systems that simply didn't exist for previous generations. But these resources only work if the individual or their loved ones recognize the need to intervene early. Taking action doesn't always mean prescriptions or surgery. It can start with changing a routine, eating differently, staying hydrated, walking more often, strengthening core muscles, eliminating certain inflammatory foods, or practicing mindfulness daily. It means checking blood work regularly, keeping up with vision and hearing screenings, asking doctors about those small but persistent symptoms, and staying socially engaged even when energy is low. It also means families have a duty to stay observant, not judgmental or intrusive, but attentive. If a loved one begins repeating stories, losing interest in hobbies, avoiding eye contact, or struggling to finish sentences they used to speak with ease, that's not something to laugh off or overlook. These small moments could be the earliest signs of a preventable or manageable condition, and every week matters in early detection. Caregivers and adult children must learn to decode the quiet messages seniors often send through body language and routines. Many older adults don't want to burden their children or admit they're struggling. So instead of saying, "I'm in pain," they'll stop attending family events or quietly start sleeping more during the day. Instead of saying, "I'm scared I'm forgetting things," they'll begin writing notes in secret or stop driving without explanation. These subtle shifts are their way of asking for help without directly saying so. And when families miss those signals, valuable time is lost. But the good news is that change is always possible. Bodies are remarkably resilient at every age, and the human spirit even more so. The sooner we stop treating aging as a passive decline and instead view it as a dynamic phase that demands proactive choices, the sooner we unlock the ability to live stronger, longer, and more joyfully. Aging is not the enemy. Neglect is. Ignorance is. Delay is. But awareness is power, and action is healing. To everyone watching, remember that the life you live after 60, 70, even 80 is still your life. It deserves care, attention, and dignity. Every subtle symptom matters. You don't have to accept being tired all the time. You don't have to accept confusion, weakness, or discomfort. And you don't have to go through any of it alone. The first step is to listen to your body. The second is to take it seriously. And the third is to act. Not someday, not next year, but now. Health is built day by day, and it starts with the decision to prioritize your well-being without apology. If any of the signs mentioned today felt familiar, don't ignore them. Talk to your doctor. Ask for help. Try new therapies. Seek out second opinions. Experiment with better nutrition, better sleep habits, more movement, and stronger connections. The sooner you start, the more likely you are to reclaim energy, clarity, and purpose that may feel out of reach. At Healthful Living 60 Plus, our mission is to help you uncover the small truths that make the biggest difference, to speak plainly about the real issues affecting seniors, and to offer realistic, empowering paths forward so you can live not just longer, but better. This isn't about fear. It's about knowledge and the strength that comes from it. Thank you for spending this time with us. If you found this helpful, we encourage you to stay connected, stay curious, and most of all, stay proactive in caring for the most important person in your life, you. From all of us at Healthful Living 60 Plus, we wish you strength, health, and peace in every step of your journey.